Bismillahirrahmanirrahim. I am Dr. Murtaza Samin and today I will talk on solar retinopathy. As we all know that on 21st of June 2020 there will be a solar eclipse which will be partially seen in Pakistan. So in that accordance I am going to talk on solar retinopathy. So it refers to a photochemical toxicity and which results in injury to retinal tissues, and that particular area which is affected is fovea, which is the point of sharpest vision, and it is also known as photopic retinopathy, foveomacular retinitis, solar retinitis, and eclipse retinopathy. It is commonly associated with sustained or high intensity light exposure, sun gazing, eclipse viewing through naked eye, young age, and clear lens. So these are the things or causes which have been commonly associated with this solar retinopathy. Mostly people see the sunlight with magnifying glass, and that also damages the retina. So how can we protect this disease if the patient or if anyone have a very high refractive error, like he's high myope or high hypermetrope, his eyes or his macula can be prevented due to his high refractive error. And if somebody has a cataract, central posterior subcapsular or posterior polar cataract, his fovea can be spared due to the cataract. And darkly pigmented fungi, or we can use protective goggles, and it is, I would suggest not to use goggles as well to see the solar eclipse, while people can also see solar eclipse with the help of telescopes, and the best way to see the solar eclipse is to see it on your own television. So how we diagnose it? Patient usually comes with the history of sighting at the solar eclipse, and his visual acuity is usually 6/9 or 6/12 or not less than 6 by 100. He will complain of blurry vision with central or paracentral scotoma, and he will say that I have a black spot in the center of my vision and my vision is not clear. The things will be blurry, tilted, and he will say that the straight line is not the straight, it is little bit tilted, and the words will be smaller in size, and he might also complain of frontotemporal headache. So this is the fundus photograph of the patient with who was affected by seeing at the solar eclipse, and you can see here the macular area, there is a yellow spot and it is bilaterally affecting this fungi. And this is the OCT image. Here this is the ISOS junction which is obliterated in both the fungi, we can easily see it. So how can we diagnose it? First of all, the history as I told, and the physical examination and clinical examination, but we can confirm it on imaging techniques like optical coherence tomography and fundus angiography. So the management is only we observe the patient, close follow-up in acute phases up from 1 month to 6 months. Vision may or may not improve, and unfortunately metamorphopsia, central or paracentral scotoma remains permanently, so they are not reversible. So take home message is we should avoid direct sunlight exposure, always do welding with protective goggles or eye shield, and safest method, as I already told you, that to watch solar eclipse on your television. And also when we do cataract surgery, while implanting IOL, the patient is under the high intense light that can also damage your fovea, so avoid that exposure as well. With this I thank you all.